big welcome to The Link. Thank you for joining us. And if you've watched any of the Find the Link series, be it on relationships, parenting, fertility, thank you so much. I hope you have subscribed. Today we're going to be taking a new topic. Join us. Welcome everyone to Find the Link session 8 of parenting. We've had 7 amazing sessions and amazing speakers throughout. We're having another 2 speakers today, Dr. Mojisola Adeniji and Dr. Ayotunde Omotoso. And I'm going to be bringing them to the screen shortly so they can say hello to us. And then we'll have Dr. Ayotunde Omotoso, who's going to start the session, followed by Dr. Mojisola Adeniji. And there's going to be a question session in between. If we have any questions, let's get them ready, put them in the chat box or raise our hands. Hello, Dr. Ayotunde, can we see you? And Dr. Mojisola, can we see you briefly? Hello, there you are. Dr. Ayotunde. Hello, Dr. Mojisola, you're muted though.
Hello, hi everyone.
Hello, lovely to have you. So that's just a brief hello from you while we get Dr. Omotoso speaking. Okay, and we have Dr. Omotoso. Do you mind putting on your video so we can see you? And I will just shortly. I'll encourage us all to put our videos, our audios off, unless we're speaking. Had issues with his connection. Let me bring him back. Okay, so I'll just introduce him briefly. We're very happy to have him with us today. Dr. Ayotunde Omotoso is a consultant psychiatrist and lecturer in the University of Ilorin, and he's made massive strides during the time of the pandemic when he founded Yours Mindfully, which is leveraging on the power of technology and social media to elevate the state of mental health across Africa, helping some Nigerian schools to integrate mental health into their curriculum, and has had targeted outreaches targeting school children and adolescents who are at home during the pandemic. He has hosted, he was one of the hosts for the World Mental Health Day, in which he hosted African and international speakers online. He's a fellow of the West African College of Physicians and has a master's degree in child and adolescent mental health from the University of Ibadan, where he also had a leadership award. We're very happy to have him with us. Loves to give to his local society and his hospital, where he serves as the public relations officer of the Medical and Dental Consultants Association. And he has a YouTube channel and Facebook, Instagram, Twitter called Yours Mindfully. So you're welcome, Dr. Omotoso. I have a feeling he has an issue with his network. Can we see you or hear you?
Oh, hello. Sorry, I had some challenges with the network.
If you're using 2 systems, you probably have to use just one of them. Otherwise, it would be
okay.
Yes. We can hear you, I think.
Right.
Oh my gosh. Looks like the network has a bit
All
of an
right,
issue.
I think this is great now, isn't it?
It is much better. Yes, just that we can't see you.
Yes, I think so too. Oh, okay.
We can't see you yet.
I'm working on that. And I'm sure that this will be resolved.
Okay, that's
in a
fine.
minute.
That's fine. You can go
Can
ahead.
you see me now? Because I can see me in the review.
Maybe I would in a minute. I can't just yet. Can anybody else see him? I can't see him just yet. I can't see you, but you can go ahead.
Okay.
I can't see you yet. It's fine.
I can see him. I can see him.
You can see him.
I can see him. Good
Okay,
afternoon, everybody.
maybe it's from my end. It's okay
Yes.
then. All right, you can go ahead.
I can see him too, Timmy.
You can see him too. No, wow.
We can see him.
Okay, well, I pray my eyes shall be opened or my computer shall be opened. I hope I will see you at some point. You're welcome. All right, so over to you.
All right. Okay, thank you very much. Apologies for the network hitch that we experienced, but then I believe that now we can hit the ground running without taxiing any further. And I'm really glad to be here. Thank you very much for the invitation. I feel honored and I'm grateful for it. I want to also thank all the participants at this meeting. So we may just give some feedback perhaps on the page. So within a minute, I'm going to be sharing my slides and sharing some thoughts on the topic of the day. As we're starting right away, and I'll be talking about parenting and child mental health. My name is Ayotunde Omotoso. Incidentally, the other Ayotunde you mentioned earlier is a friend of mine, so it's good. It feels good to be here, and it feels like this is family already. So the objectives of this will be real simple, because what we want to know is to understand, first of all, who a child is, to then understand the roles of parents, and then to see how we can boost mental health through parenting. So who is a child? Please, I would like those here at this meeting to use the chat room right now. Tell me who you think a child is. I'd really like to know, I'm curious, who is a
Child. Who is a child?
Yes, exactly. Who is a child? You may use the chat room right now. I want to know who you think a child is, because we need to be on the same page. Can you hear me?
Yes, we can hear you.
All right, I'm scrolling through the gallery right now to be sure that I'm being seen. Okay, yes. So anyone up to 18 years? That's about it. Yes. So a child is anyone that is 0 to less than 18 years. And then, of course, we already know who a teenager is. A teenager has, in the teenage years, that's 13 to 19 years. And then an adolescent is someone who's 10 to 19 years. So that essentially means that an adolescent, most adolescents are children, except, of course, those who are 18 and 19 years. All right, and there have been different views on child development through the years. There's a view on original sin. That's the view that says that children generally are born into sin, and by virtue of that, children are evil, and they would need to then be trained out of that frame. The tabula rasa view, tabula rasa, tabula meaning table, or meaning a slate, and rasa meaning blank. This was developed by John Locke, and what he was describing was a situation in which children are born with a plain mind, and it is what you put into that mind that then determines how well a child does. So a child is not innately good or innately bad. It depends on what you soak into them, and that's why children have been described as a sponge. Of course, there's another entirely different view, which is the view of innate goodness, that describes children as inherently good. So of these different views, I'm really curious to know what the views of the audience here would be. Which one do you think it is? How do you see children? Do you think that children are generally bad in and of themselves? Do you think that children are innately good? Or are you in the middle, thinking that children come with a blank slate and whatever you put into them will then determine how well they do? So let's know in the chat room what you think. There are other views about children, because over the years, there's been a shift from philosophy to psychology. In the 19th century, for instance, people started developing different theories on describing the development of a child. And Arnold Gesell was particularly exemplary in this regard because he had talked about the developmental milestones of children. He actually studied a couple of children to see how well they were doing, and he described the maturational approach. That means that children, generally speaking, in the beginning of their years, you may find out that they're not learning some things, but then as they grow, as they mature, they begin to pick on some of those views. So let's look at the stages of child development. And I think this slide is particularly important because this is the slide that then talks to us about the different stages from the prenatal period. This is the period where children, of course, it talks about conception all the way through gestation to the time a child is born. Through infancy, the infancy period talks about the first 1.5 years of a child's life. Early childhood refers to that period between infancy and the time a child is 6 years old. Those are the preschool years. And of course, the years after the preschool years will of course be the school years. Okay, and then the middle to late childhood, that's 6 to 11. Adolescence, which we already defined, will be the period from 10 to 19 years. For me, this is one of the slides that I particularly like because it talks about the pillars of development. If we're saying that children need to develop and parenting is a big part of that, what are actually those pillars of parenting? And we can look at that along the lines of the physical pillars, the cognitive pillar, the emotional, social, and I like the fact that there's also the spiritual pillar because children need to develop in all of these domains. And what are the roles of parents? Remember that at the beginning of this conversation, we identified the objectives, which are mainly threefold, very simple objectives this evening. The first being who exactly is the child, and then the second being what are the roles of parents, and the third would then be how can parenting be used to boost the mental health of children. The role of parents essentially would be for protection, for provision, and for preparation. In my own case, I'm sure that there are many parents in the room. There will be other people in the room who are curious about parenting. There will be people here who are mental health specialists, perhaps. There may be some doctors here, judging by our hosts, as well as the name that I was initially called. So I'm guessing that we also have here doctors in the room. In my own case, I'm a doctor, I'm a child specialist, and I'm also a parent. I have a daughter, and then we also have twin girls. So it's a house of girls. It's a girls' hostel, more or less, and that's where I live. And I recognize that my role is to protect, is to provide, but beyond that is to also prepare those girls for the future. So boosting mental health through parenting. First, we need to know what exactly is mental health. Right now, I can hear some footsteps on the staircase, so I'm guessing that one of the girls is probably coming downstairs. I had them, but I'm not quite sure that arrangement is working at the moment. So let's find out exactly what mental health is. The World Health Organization describes mental health as having the capacity to do 4 things. The first thing is to be able to cope with stress and difficulty. The second thing is to be able to deal with stress. And coming out of a pandemic year, many of us can relate with this. Having children in the house who before now were going to school, were expressing themselves in other ways, but right now they need to deal with the changing times. So dealing with stress is integral to the definition of mental health. And the fourth one here is to make positive contributions to society. Yes, absolutely, Pastor, you're correct. To protect, to provide and to prepare the children for the future. That's the role that we have as parents. I like the definition of mental health that speaks specifically to children. Because in that definition, what we see is that children have the capacity to learn. They have the capacity to enjoy friendships. They can meet their challenges in life. And then this last one is very important. They can develop talents and abilities. I was relating with a nurse on the ward, and she was telling me her experience with parenting. And she talked about a boy in the neighborhood who would play football so well, sometimes even by himself, that other people will gather just to watch this boy play football. But guess what? Those skills weren't honed, those skills weren't built. And you had a boy who now, at the time I was speaking with this nurse, had turned 12, and absolutely no structure had been put in place to develop that talent in a way that was marketable. You know, you may have seen the quotes that talks about a racket, or yes, a tennis racket in the hands of an amateur will probably be worth something in the range of $10. But then if you put that same racket in the hands of Serena Williams, you're talking about millions of dollars. What's the difference? The kind of childhood she had and how a parent recognized that talent early enough in her. So what was in her as a deposit became developed and then deployed. And today we know her as someone who is a genius at that skill because it was developed. So developing talent, very important. This brings us to parenting styles. And I'll just mention the fact that 4 parenting styles had classically been described. The authoritative parenting style, the authoritarian. Authoritarian often reminds me of a political party, probably because it sounds like a political party in the United States. But then I use that many times to remember what I should not be. Not that there's anything wrong with that political party, by the way, but then it helps me just remember, because authoritative and authoritarian sound a lot alike. So I remember that authoritarian sounds like something from a nation or something that is really serious. And authoritarian parenting styles, just so that we understand these parenting styles, there are 2 things involved. One is love, the other is leadership. So if you're loving your children and all you're doing is loving them, that means you're indulgent. If you're leading them and all you do is lead them, that means you're authoritarian. However, if you're leading them and loving them, that means you're being authoritative. There are times that you correct them. So you correct them with one hand, and as we described, you use both hands to then embrace them. So those are the classic parenting styles. However, more recently, we've been talking about helicopter parenting, which talks about you go to school with your children. So just day before yesterday, an adult was sharing with me his experience of getting into a private university in Nigeria, and his parents took him all the way to school, stayed there. If they had the permission to enter his hostel, they would have done that. But then, of course, they had to go back home. And 3 days after that experience, this same young lad fell ill. In fact, he felt so ill, he had to call his parents. They had to come pick him from school. Because all through life, what he experienced was having his parents be there at every step of the way. He wanted to write JAMB, they were right there. He wanted to do common entrance earlier in his years, they were there. On a daily basis, they would take him to school, take food to him. During break time, they will be there asking the teacher questions. So that essentially is helicopter parenting. Just think of the propellers of a helicopter and you would remember how helicopter parenting works. So as I dovetail to the end of this conversation, bearing in mind that we have 2 speakers, the goal of parenting is resilience. That's what it is. You want to make sure that you're building that child for life so that even when you're not there, that child is able to do well. And in doing well, you want to look at that in terms of doing well as an individual, before you look at that child as an institution. So as an individual, you want to build a child who is confident. And if you're authoritarian or if you're shouting down a child, chances are that that child is not going to grow up to be confident. They wouldn't know what their voice is. And it moves all the way even to the choice they make in marriage. They're not able to be confident enough to make the right choices at every step of the way. Now you want to make sure that that child is also fun. It's not just about their frame. They've got to be fun. They've got to be relatable. Other people should find them as children that they can engage with in a conversation. And then you want to make sure that those children are functional, and you want to build them also in the faith. For family, cordial relationships is a big one. It's not just about having children who score high grades in their academics, but then at home, they're not able to connect. And of course, in the larger society, they've got to be well adjusted to different social contexts. And I'd like to say, as I conclude, in the hope that there will be questions from this session, that I like a particular quote about parenting by someone who has been described as the wisest man in the world. And what he had to say about parenting was to train up a child in the way that child should go. And when he or she is old, they would not depart from it. I thank you very much. I see this presentation as an introduction to our conversation. And I hope that in the feedback section, we will be able to talk about mental health and in an in-depth fashion, more deliberately about how we can boost the mental health of our children. I thank the hosts and everyone that has listened.
Thank you very much, Dr. Ayotunde. We'll just thank you very much. That was an awesome session, very concise. I don't know whether we have any questions from the house. You can raise your hand electronically. You can type in the chat box. Dr. Omotoso is actually having another engagement shortly, which is why we're taking his question and answer session first. But he's touched on many things, including some of the things we've talked about in the past, including parenting styles and intentional parenting. And he's even moved it from childhood to adolescence and how important it all is and how it all fits together. So it's been very integrative. Does anybody have any questions for him? Let's make this worth his while. Give him a bit of a hot seat experience if we can. But thanks for an amazing presentation. Okay. Any questions for him? No? Okay. If you don't have any questions, I probably would have one. Just see that. Okay, no questions, right? I encourage us to mute our microphones. I'll mute everybody now. A minute.
All right, is there a question? I'm not quite sure there is. So
I'll ask you a question.
Usually when there's no question, there are two possibilities. Okay,
yeah,
okay, because it's either it was entirely clear or entirely not so. So maybe I should then break the ice and just mention something very important, since this is about mental health, and more we're relating with adolescents who have depression. You know, many times when we think of children, we think of the younger ones, but of course from this presentation, most adolescents are also children. They're not very much yet into their adult years, but then clearly they're no longer just the younger children. And adolescent depression is one of the things that we've been dealing with as professionals. And I may just mention at this point that in identifying if an adolescent is depressed, they may not have the typical sadness that we see with the older population. For them, sometimes it's even, they may become cranky, they may be irritable, they may just get angry, they may sit in their room with their computer all night, they may be socially withdrawn. So the moment you begin to notice those things, an adolescent may be depressed, and it may be time to talk about it. And then there are ways of even preventing that through parenting. And that would be as your children grow, your role as a parent will change. And then you may need to become a friend, more of a friend. Of course, that's important throughout, but then that role becomes more pronounced in adolescence. So on a daily basis, even for the younger children, how was school? How did you do today? Have engage them, try to draw them out of their shell. Yes, so why is it that children, there's a question here in the chat room, why is it that children who have been brought up properly develop mental problems? I think this is a beautiful question. Mental illness comes as a combination of three factors. We describe that as biopsychosocial. That's according to a model by George Engel in the late 1970s, but it's still quite important to use that in 2021. So there are biological reasons why there may be mental illness. There are psychological reasons, and then there are social reasons. Parenting will fall in the domain of psychosocial factors. But remember, there are biological factors. Mental illness is an illness. So like physical illness, it's an illness. It's like saying, why is it that even after having a very good background, some people go ahead and develop headaches or hypertension or diabetes, or you can name it. Those are physical illnesses. Mental illness also has those genetic ties or molecular bases of it apart from the psychosocial aspect. And that's the reason if a person has even been brought up well, they may still be prone to mental illness if there are other vulnerability factors. But that doesn't exclude the importance of proper parenting as a protective factor, even in those cases. So what makes a 7-year-old consider suicide, and what's my experience with social media addiction and cyberbullying? So maybe I should start from the end. With cyberbullying and social media addiction, well, social media addiction, more and more we're seeing this. There's still ongoing research about this, but then in the DSM-5, which is the American Manual for Psychological Diseases and Disorders, DSM-5 came out in 2013, and addictions were expanded to include other behaviors apart from just addictions as we know it in terms of substance use. So yes, social media addiction, more and more people are getting addicted. And I like the fact that Instagram and some other social media sites have a place where you can monitor and even manage your use of social media and the time that you spend on it. So if you realize that a person is spending up to 18 hours on the internet, there's a concept called internet addiction, and that may be what that person is experiencing. If you have an adolescent, a child, or even an adult for that matter, experiencing this, it may be time to refer such a one to a professional. So yes, some people experience that. For cyberbullying, more and more we're seeing children who are being cyberbullied. Now, both the bully and the bullied many times are victims. So the bully may be someone growing up in an environment where he's experiencing bullying firsthand from the way the parents treat each other. If there's intimate partner violence, for instance, if daddy beats mommy or mommy is verbally abusive towards daddy, it's possible that child goes to school thinking that's the normal way to relate with other children. Remember again that children who have low self-esteem want to put other people down in order to feel good. So they may become bullies. For the bullied, they may experience depression, anxiety, low mood, and all sorts of psychological sequelae by virtue of being bullied. And one way we may know this is through academic performance. If you see a child whose academic performance is declining, or you see a child who has school refusal, says, mommy, I don't want to go to school, explore it. Don't just assume that that child is being lazy. It may be that that child is being bullied. And with bullying, it may happen not only with cyberbullying, which is internet bullying, but actual physical bullying in school, real time. And the bullying may be from peers and it may also be from teachers. I see that there's another question in the chat room right now. Yes, children with low self-esteem can become bullies. Absolutely, this is correct. And our host has a question for me. I'm curious. My question is, what's the question that you have for me?
No, that was the question. That was my question. That last one. Yeah, that's why it has many parts. That was my question.
Okay.
Yeah, you've not answered the part of what makes a 7-year-old consider suicide.
Yes. And we can prevent suicide. So let me mention that the rates of suicide have actually gone up a lot. I don't want to mention what the prevalence has been, but suffice to say that the rates have really gone up and there are ways we can prevent it. There's a 2/3 rule that says that 2 to every 3 people who die by suicide, we try to avoid saying commit suicide so it doesn't sound like a crime, but we rather emphasize the fact that many times it's caused by an illness because it's not natural or normal for people to want to take their own lives. So 2 out of every 3 people who die by suicide would have told someone 2 to 3 weeks before they actually do so. But what often happens is they tell someone, the person says, oh, hush, don't talk like that, don't say that. They don't explore what the concerns of that child or that adolescent, and they don't refer to a professional. So every conversation about suicide should always end with referral to a professional. This is so key, it's so important. I'd like to encourage you, thank you very much for this invitation. This material I'll also drop on my social media site, Yours Mindfully, on Instagram. We're on Facebook and Twitter as well. And it's been a delight relating with you. If there's any other question, of course, I'll be most glad to take it right now. And then, of course, I'll put these slides on the site that has been mentioned. And I'm glad that our host has talked about our YouTube site. So I stole into your site. Let me quickly mention that right here. And I enjoyed what I saw. Thank you for the great work you're doing for parents and for the society. And I'm appreciative and we celebrate you.
Thank you very much, Dr. Ayotunde Omotoso. It's been an amazing presentation, excellent and brilliant. Thank you very much. I think one last person has put another comment on this and said, should you take a 6-year-old serious when they talk negatively about themselves? I think that's a bit of a dicey one, but over to you.
All right, so yeah, I like that question. And whoever is asking is a parent who clearly is already providing, protecting, and wants to prepare that child for the future. So yes, if a 6-year-old is talking negatively about themselves, don't take it lightly. In fact, what I would say is before a child turns 6, if a child is old enough to speak, that child is old enough to speak positively. So you can begin to teach children specific things to say, specific things to profess. Some people would describe that as confess, specific things to express. So that child grows up in an environment where they already know that it's right to speak right. Also, if a child is speaking negatively, watch the environment. Albert Bandura came up with a social theory where he described how children learn through social modeling. Children would generally reflect what they see in their environment. Earlier, we talked about tabula rasa. Children's minds are blank, but what you impute into that mind is what they then bring out. It's like the computer, giggle, garbage in, garbage out. In this case, healthy things in, healthy things out. So it's out of the abundance of what a child has in their heart that they're going to speak. And if a child is speaking negatively all the time, and in your own environment at home, there's no negativity, begin to watch what they're being exposed to in school. So when I had that kind of experience of a child in the house saying something negative, I immediately exploded. Where did you hear that? You didn't hear that from home. And we traced it and realized it was the school teacher. So what we did was to essentially go to the school. We didn't fight with the school or anything. We simply educated the school teacher. No, don't say this kind of word to a child, it's not good for their mental health. And in some of the schools I've gone to, what we eventually did was to even organize a mental health session for the teachers for free. Sometimes at the PTA meeting, we would simply do a session on mental health, because sometimes people don't do these things because they mean any harm. They just don't know what the implications are. And that also takes us to the aspect about punishment. However you discipline a child, ensure that it is boosting their mental health rather than damaging it. I like the fact that in the gallery right now, I can see some people. I think there's some children also who are joining us at this meeting, I guess. And it's good to know that we're learning together about parenting and about how we can boost our own mental health.
Thank you very much again, Dr. Omotoso, and well done for the great work you're doing. I think more schools would need to engage you so that the terrain can change a little bit and we can have a better environment for all our children. And thanks for sparing time at such short notice. We really appreciate it. And I know you need to leave because you have another session. And we just want to say thank you again.
Thank you very much. Thank you. And from all of us at Yours Mindfully, would like to really thank you for this opportunity.
It's a pleasure. God bless you, and warm regards to your family. Okay.
Thank you.
Right. Well done, everybody. You've been an amazing audience. We're going to our next speaker, an erudite lady. Where is she now? Looking for her. Yeah, there she is. I can see her now. I thought I'd missed her. Dr. Mojisola Adeniji is an amazing lady, a friend of mine, and she's a psychiatrist in 2 continents. Very, very proud of her. So she's a fellow of the West African College of Physicians in Psychiatrists, it must be, in Nigeria. And she's also a member of the Royal College of Psychiatrists in the United Kingdom. And she's going to be shedding more light on the topic. And we are really, really happy to have her here. And she is a great scholar, great learner, amazing person to know. And it's a pleasure to have her here. So over to you, Dr. Adeniji.
Thank you very much, Timmy. Thank you. I just want to thank you. First, thank you for the opportunity to be here, and just kind of be an instrument of just serve and share my experience and parenting and mental health. Dr. Ayotunde has done a fantastic job. He's laid a very good foundation talking about a lot of things about parenting, and I think I'll just be diving in a bit deeper into a couple of things. So can I go ahead and share my slide?
Yes, you may. Go on.
Okay, thank you. Okay, so, right. So, right. So, just as a way of introducing, Dr. Ayotunde has already defined who we'll refer to as a child. So the United Nations Convention on the Rights of the Child defines a child as everyone under the age of 18, unless the law is applicable to the child. Majority is attained earlier. So there might be a few countries that might define a child as someone, depending on the setting. So some countries say that a child is anyone below the ages of 16. But generally, I think majority of countries adopt this way of defining who a child is. So what I'm going to be doing is I'm going to be talking about the various mental illnesses or mental disorders that a child could experience from right inside the womb to when the child becomes reaches the age of 18. So I'm going to take it across that that aspect of life. And I'm sure as I begin to speak, what I'm going to do is I'm going to talk about, mention some examples from my experience working in Nigeria and the time I've spent in the UK for our international audience, with those sorts of unique mental illnesses that may be foreign to us as people in diaspora, but has become a major issue of concern. So I'll just go on with that. So in pregnancy, so it will be important to state that as a parent, you can start to actually take care of your child's mental health right from inception, right from pregnancy. So it is important that once a person realizes that they are pregnant, they become quite intentional about how they take care of themselves. So I mentioned here, I talk about good antenatal care. So it's important that when you find out you're pregnant, you register, on time, you get the right sort of support and care, you see your specialist, you go for regular visits. And it's also important at this time that you are careful what you ingest. So it's been found that people who use certain types of even prescribed medication can actually affect the development of the brain of that child and actually affect the mental health of that child when that child is born. So there are several classes of medication. I don't want to go into too many, I don't want to use too many medical lingo, but it's careful that if you're on any prescribed medication while you're pregnant, that you discuss with your doctor and say, can this medication affect the development of the brain of my child? Can it can it predispose my child to having a mental illness later in life? There are many drugs like that, and it's important that we have those sorts of conversations. You need to be careful about other things such as alcohol, drugs. It will be, currently right now I'm working in a service where we offer services for people who are addicted to substances, alcohol, cocaine, heroin, and there are females who are addicted, who may fall pregnant. And because they struggle with addiction, some of them actually use these very dangerous substances while they are pregnant. And studies have shown that children who are born to mothers who are alcoholic or drug addicts, eventually some of them end up at high risk of developing mental illnesses later in their lives. They are prone to attention hyperactivity deficit disorder, anxiety, depression. Some of them eventually even go on to use alcohol and substances when they are older. So it is quite important that the pregnancy period is a delicate period, and it's not something that we should take lightly. It is important that you are aware of the mental development of, and even an unborn child is very important in this stage. I'll move on to the next stage. So what happens when the child is born from infancy to the under fives? At this stage of life, children are developing. Dr. Ayotunde had mentioned several stages of development, but there are several things I think as a parent, you should start to pay attention. The way a child who is a baby and under 5, if is experiencing emotional distress or mental discomfort, the way they would express themselves is different from the way an adult will. So there are several things that children under this in this age group would usually begin to manifest. So you can find a child who had a certain type of sleeping pattern. Now you find out this child maybe is not sleeping well. There's a disruption in the pattern, and that can be a pointer to something might be amiss. Also, a child who is usually by the age of for most children by the age of 4, 5, most children are toilet trained. They're able to control their bladder, able to go to the toilet by themselves. But if a child who has attained toilet training, able to go to the toilet by themselves, after a number of months, after a period, you notice that the child starts to get wet, the child starts to ease themselves in very inappropriate places, then it might be a pointer to the fact that there may be something wrong with this child. I mean, there have been instances where, and I will talk a bit about this a bit later in the presentation, that children who are either being abused, sexually abused, who are experiencing very difficult times maybe they are in a home where there's domestic violence, or the parents are negligent, or there's a difficulty where they are growing up. Children who had attained toilet training and all that, if they are actually experiencing a lot of emotional distress, they could start to weigh on themselves and all that. So it is something that might be a pointer to a mental illness ongoing. Then, well, it's not unusual rather for a child to throw tantrums. There's the phase of growing up that children call that parents call the terrible twos, where at the slightest upset, children are throwing a tantrum and all that. Yeah, that's part of a child beginning to develop emotionally, beginning to realize that throwing a tantrum sometimes does not get you what you want. Sometimes you have to, as a parent, have to teach them how to ask politely, or if they are declined, how to manage their emotions. But at a certain stage, usually after the age of 6, if a child is still throwing a tantrum, being excessively irritable, excessively moody, this might be a pointer to something else going on, and the child might need to actually see a professional. So from the ages of 5 to 18, there are many things that can happen, many mental illnesses that has been shown to take place between the ages of 5 to 18. One of it is anxiety. So anxiety, typically, Dr. Ayotunde had mentioned about sometimes children withdraw, they'll be irritable, they don't want to, they don't want to engage, they want to go to school, they become excessively afraid, they don't want to leave the house. It might be a pointer to the fact that child is actually experiencing an anxiety problem, and we need to see a mental health professional. And then depression. So for a lot of young people, especially in the adolescent stage, a lot of them experience, because there's peer pressure, the pressure to want to belong, the demands of the changes that they're experiencing emotionally and physically, a lot of adolescents, and also because of the hormonal changes taking place in them, a lot of them are actually prone to becoming depressed, and it's at this stage that where we have one of the highest incidences of attempted suicides, and people just really struggling with their mood. So these are some of the quite common emotional disorders, mood problems that children this age would experience. Another one I would like to mention is attention deficit hyperactivity disorder. Now, so what this disorder really is, sometimes some teachers or sometimes parents might say, oh, I have this particular child is not unable to sit down for a long time, he's disrupting the class, he's always jumping from disrupting the scattering the furniture, whenever he's in a room, he's there. Excuse me, whenever he's in a room, he's there, because everything's like upside down, he's unable to sit still. So when this happens, and the child happens to be exhibiting these characteristics in school. Usually you would get a report from school that the child has been disruptive or unable to, sustain attention in class, disrupting the lessons. Usually this will happen in school, and this would also happen at home. So what this would require is seeing a psychiatrist or seeing a mental health professional. Excuse me. And I'm not saying it's every child who is hyperactive who has this disorder, but if a child is excessively disruptive, then it might mean the child might need to see a professional. Another common problem that is rife in people in this age group. This is the age when a lot of children start to experiment. They experiment with drugs, alcohol, cigarettes, cannabis, and this is for a couple of reasons. A lot of times, especially in this day and age, children are exposed to things they see on social media. There's a lot of information on mobile phones. Information is so. I remember growing up and the things I used to see about drugs and alcohol was just on TV. Now it's everywhere. It's on laptops. It's on mobile phones. It's on TV. The information is so easy to access. So children this age are quite, of course, they want to experiment. They think it's cool to, to drink or to have a smoke or to, the media doesn't even help issues, because there are aspects of the media that is actually glamorizing, actually glamorizing this using substances. So it is important that as parents, we are quite vigilant. I will use that word, vigilant, and look out for signs. So if a child starts to becomes withdrawn, a child starts maybe lock themselves excessively in their rooms, you see them sometimes, to mask the effects of substances. Some people want to lick tom-tom or chew mint gum to cover their breath. Sometimes they may leave the house for long periods of time and they don't give accounts of their activities. These are some of the pointers to a child who is experiencing substance use problem. The other thing is self-harming. Now, when I worked in Nigeria, I didn't see this very much, this self-harming very commonly among young people in Nigeria, but I live and work in the UK, and it's something that a lot of young people do. And so self-harming, for some young people, a way of dealing with distressing emotions or difficult emotions is that they actually turn on themselves and they harm themselves. So they could cut themselves with knives. Sometimes they hit their head on the wall. Other times, they engage in very risky behavior. So they may be engaging in promiscuous behavior. They may be, driving and breaking the rules while driving, putting themselves in really dangerous situations. And self-harming is not the motive behind self-harming is not to necessarily for the person to kill themselves, but a lot of the times is kind of like a cry for help. A lot of the times because these people are really struggling. So this is one of the things I actually see here that is quite common amongst a lot of adolescents and among a lot of young people. Another thing is gender identity disorders. I'm sure for those of us that, I don't know how it is in Nigeria now, but for those of us that live in this neck of the woods, we've been hearing about transgender, we've been hearing about gender dysphoria. Those are the things that is becoming, it used to be something that was rarely seen among young people. Now it's becoming almost like a norm. So usually when it comes to a child's sexuality, there are two aspects of a child's sexuality. So there is your gender. So your gender is what you feel like on the inside. So there is, okay, so there is your gender now. So like I obviously have female features. So inside I feel like a woman, but people who have gender identity problems, in their physical appearance, they might appear as a woman, but they will tell other people that I don't feel like a woman inside. I feel like a man, or I don't even know where I am. I don't even know whether I'm a man or a woman, and this, for a lot of the people who actually have this sort of experiences, they actually is very distressing for them. It's very distressing for them because they don't know how to express their sexuality. They don't know how to, when they try to, other people find them a bit odd, then they begin, a lot of them also, aside from this disorder, they tend to struggle with depression and suicidal thoughts and all of those other things. So this is something that is becoming quite common among a lot of young people. And I think one of the other reasons why is because it's a bit controversial, but there is they're beginning to sort of normalize it. They begin to sort of normalize it. I'm not very sure now, and I would mention this example, and I'm sure most people will know who this person is. He's called Bobrisky, and I'm not sure if he has a gender identity problem, but he was obviously male, and he's somebody who over time changed his physical. He's never come out to say, oh, I feel like a woman inside. I don't know what his motives are, but that is somebody obviously over time who has changed his physical appearance. He looks very much like a woman. He has the female features, he dresses like a woman and all of those things. So those are some of the things we as parents, we should be on the lookout for, because in schools, on the media, is becoming normalized. So let's just let's be vigilant and let's be careful the kind of ideology and kind of things that is being taught to our children, as they interact with their peers, as they go to school. Sorry, I repeated that point. I'll just skip that point. Another common mental disorder are eating disorders. So there are different types of, I'm going to mention the two that I know that are quite common. I didn't see very much in Nigeria, but it's a bit more common here in the West. So there are eating disorders and there's one called anorexia nervosa. So what happens in anorexia nervosa is that the person has a morbid fear of being fat. So this person can actually appear extremely thin. Physically, they are thin. I mean, if you measure their weights, measure all the parameters, they are actually extremely underweight, dangerously underweight to the point that they could actually die. But if you told them that they were not fat, they would never believe it, because in their minds, and the way they view themselves in their mind is that they are extremely fat. So this, the people that belong to this age group, a lot of them, sometimes might engage in this behavior of not wanting to eat, and I think part of the pressures of that is that there's what the media projects, that if you have a certain body shape or you have a certain size, that's what is regarded as, that's beauty, the standards for beauty. When you appear very thin or you have a certain body shape, that's what is acceptable. And a lot of young people in this age group want to kind of step up and look like that, and then they start to compare themselves to their peers and then what they see on media and all of those things. So sometimes they can actually end up becoming anorexic. Another form of eating disorder that's quite common in this age group, especially here in the West, is bulimia nervosa. So in this case, the person actually begins to do things to themselves. So they might induce vomiting. So when they eat, they actually forcefully make themselves vomit. Sometimes they might take tablets to help them go to the toilet to, expel a lot of, urinate a lot, or, go to the toilet frequently, so that the food they are eating would not stay in their body, and so that they won't grow fat or put on weight. It's also another form of eating disorder, and it's quite common. So, I mean, I know no parent ever wishes that their child would have this sort of things, but these are, as a parent, it's important that we look out for these things. If you see that your child is beginning to suddenly lose excessive weight, maybe saying, oh, a child who used to eat a full plate of rice before is saying, oh, I don't want to. I'm not saying everybody that is not eating a full plate of rice has an anorexia, but if this persists for a long period of time, and the person keeps saying, oh, I think I'm fat, so I don't think I'm beautiful, I don't think I'm pretty, I don't think I'm good enough, that might be a pointer to the fact that this person might be struggling with an eating disorder. Another common, and then Dr. Ayotunde had spoken about this briefly. He talked about bullying. Bullying, I don't know, I experienced bullying, and I think quite a number. I was a victim of bullying, and it's quite common in this age group for people to bully and to be bullied. And for children who are being bullied, a lot of times, the way they might not want to come out and express to their parents or carers and say, oh, I think I'm being bullied because of many things. They might be afraid, they might feel ashamed, they might feel they cannot be helped. But, it's important that, I've talked about vigilance. Being vigilant. I've spoken about that I've said that so many times during this presentation. And we support children who are experiencing this. If it means taking that child out of that school, to take that child out to, save that child from that situation, then do that. But the consequences of bullying is, it can be far-reaching. Children who are bullied can become suicidal. There have been situations where children were bullied to the point that they actually, committed suicide, and they killed themselves. And I will also speak about cyberbullying, because a lot of young people have access to mobile phones. So Facebook, Instagram, Twitter, TikTok, all of those things people are there, and maybe somebody posts a picture about themselves, and they get negative comments, they are ridiculed on social media. It's a form of bullying, so we should be vigilant. Whatever social media platforms that our children are looking at, we need to keep an eye on it and make sure that while they are there, they're actually safe, and they're safely actually interacting with those platforms. Another an important issue is school refusal. Dr. Ayotunde has spoken about it. I'll just say a bit more about that. So there could be a couple of reasons why somebody could refuse to go to school. A couple of reasons. Bullying can actually be one of it. Sometimes children can be anxious leaving home, because sometimes they're quite attached to their parents, and they're anxious about, okay, what's going to be going on in school? I don't have any friends. I feel different. I feel like I don't belong. All of this. So if a child is refusing to go to school, it's not necessarily because the child is being a bad child, but it should be helpful to have a conversation with that child and say, why are you refusing to go to school? What is going on? Is there something, something that needs to be, looked at quite deeply, because there could be many reasons why a child would refuse to go to school. And I already spoke about social media. I think we can't bury our heads in the sand. Social media is everywhere. As a parent, you should be almost more social media savvy than your children. You'll be surprised what a 2-year-old can do with a tablet, and the kind of, I've had friends who would hand over tablets to their children, and they would, by the time they get back and see they say, how did you end up on this website? Children are able to, they are so adept at it. And while they're on, if it depends, and it just really depends on you as a parent, when you want to decide to let your children, begin to look at your engage with social media platform, you should support them, you should guide them in as much as they're on those platforms. Those platforms, there are many useful things that you can actually learn on your social media. It does have its positive aspects. It's not all negative. But as a parent, you want to protect Dr. Ayotunde talked about, protecting, part of your duties as a parent to protect. So while they are there, keep an eye on what they are doing, engage with them, have conversations with them. Don't make them, engage with them in such a way that they'll be afraid to tell you if they come across something negative or something that they are finding difficult to navigate. Have an open and honest conversation with them about, using these sorts of platforms. Gaming. So gaming is, I grew up in Nigeria. I don't know, gaming is a thing of, I think it's more of a thing of the West, where children play certain types of games and they could become quite addicted and all that. It's not a very common thing in Nigeria, but over here, there are children who spend long hours playing games. I mean, the DSM, DSM-5, which is one of the diagnostic classification that we use to look at different mental disorders, is actually beginning to look at gaming addiction, where children would for long periods of time stay away from other people and they're spending long hours gaming and all that. So as parents, we want our children to be tech savvy, but we don't want a situation whereby it becomes extreme and it begins to affect other areas of their lives. So I've said so much about quite a number of these mental health disorders. These are the ones that I feel that are most pertinent. There are other ones I just couldn't talk about in this slide. Maybe if it arises as a question, I could address it. But it's important that so mental illness or taking care of the mental health of your child is not just when it's right from pregnancy, up until when this child becomes an adult. I'll talk about other influences briefly, about other influences on a child's mental health. Now, we hope that we're all in good, optimal physical and mental health, but it's been found that research has found that a parent who actually struggles from mental illness can actually a parent who isn't in their mental health, who isn't optimal, who is struggling with maybe anxiety, depression, or other mental illnesses, taking care of and not a child. Of course, the parent is not in the best state might not be in the best state of mind to be able to take care of that child. So that child might not be getting, the best of protection. They might not be adequately prepared, with social skills, all of the development that is expected for a child of that stage. So parental mental illness is actually one of the risk factors, or one of the factors for a child eventually becoming mentally ill. Dr. Ayotunde has spoken about intimate partner violence. It's a form of domestic violence where if a child grows up in a place where daddy and mommy are constantly fighting, there's physical assaults, maybe they are stabbing each other, they are abusive, verbally and physically abusive towards each other. Of course, this would adversely affect a child's mental health. Also, alcohol and drug use in parents. I talked about alcohol and drug use in pregnancy, but a child who grows up in a home where the father and mother are consistently abusing alcohol excessively, they're always high on something, high on cocaine or heroin or cannabis right in front of the child, that child is unlikely to, is very much at risk of getting, a mental disorder later in the future. They're at risk of eventually possibly becoming addicts themselves. They're at risk of anxiety, depression, and a lot of really, adverse mental outcome. Also, poverty, is also another adverse situation that can affect a child's mental health. As much as possible, it's good to have children, but I belong to the school of thought where I think if you're going to have children, you should be financially ready to take care of, because taking care of a child, there is finances involved. You're going to be paying school fees, buying diapers, buying food, taking the child to the hospital, getting all the necessary, things is the child. So if a child is born into poverty, the child is going to come as largely to, it's going to be disadvantaged, going to be deprived emotionally, financially, their education will suffer. So, and this has been shown, by research and in many studies that children who are born into very deprived situations tend to be at risk of developing a mental illness. I should also talk about the influence of peers, especially with children in the adolescent phase. Peer influence is quite key. There was this experience I had speaking to a parent, and she was telling me that her daughter was self-harming. She was cutting herself. And she found it really, really odd that the daughter was cutting herself. And then she went and asked and found out that her daughter had all of her friends, her friends in her circle, all of them were also people who are also self-harming, So to them, I think when we had this chat, she felt, the young lady felt that it was something cool to do. It was, and she didn't want to feel out of place because everybody else was doing it. She also had to do it, So it's better that we keep an eye on the type of friends that are around our children and the sort of ideology that they sort of imbibe, and so that our children are not unduly influenced. So I won't go so much in depth into treatment, because I think this is more for the mental health professionals, but I'll just say something generally that, a child having a mental illness is not a hopeless situation. There's support, there's treatment. So usually, sometimes, or for a lot of the mental disorders in childhood, there is, we can give them parents who might not have the skills, right parenting skills, can give them parental training, and also engage them in the treatment of the child. They are actually a key component of how we treat the child, because this child is going to be, most times, after seeing the doctor, the child is going to be with the parents majority of the time anyways. So we want to give parents the right skills, the right knowledge to be able to manage these children when they are not, when they're not in the hospital. Also the school, Dr. Ayotunde talked about giving like mental health education, I think it's quite key. I think the school is a good place to actually educate teachers, school administrators, because most of them don't, they don't have bad intentions towards children. They might not just be able to recognize when a child is, they might not be able to differentiate from a child who is being naughty and a child who genuinely has a mental health problem. So sometimes people need to be sensitive, educate teachers and school administrators, and need to be sensitized as to how to be able to record. They don't necessarily they don't need to be mental health. They don't need to be psychiatrists or nurses, but you can, by the time you just give them information, when a child is actually struggling in class, they're able to say that there's something wrong with this child. This child is not just necessarily he's not just a difficult child. This child actually genuinely has needs. And a lot of times, teachers have actually saved the lives of children. There have been instances where a child who was being sexually abused at home, or there was, domestic violence at home, because this child came to school and maybe the teacher saw some mark on the child or saw that the child was withdrawn, the teacher kind of flagged it up. And from there, the child was maybe taken away and, put in a better environment and those sorts of things. So the school is a very good place where we can actually offer support for people who are actually struggling with mental illness. social services. I know people don't like to hear about social services because they become involved in family situations when things have really, really become terrible. Like this child is obviously being put in a dangerous situation. This child is either going to die or end up, in a very, with serious issues. Somebody's going to be talking about safeguarding. It's going to be one of the series later, a bit later down, but a lot of parents are not happy when social services gets involved in their situation because it shows that they are not actually carrying out their duties as parents. They are not taking adequate care of this child, and that's when social services gets involved. And more often than not, removes a child from this situation and puts them in a safe place. Other ways of treating can include counseling. So sometimes a child just needs appropriate counseling to support them with maybe they are struggling with self-esteem problems, anxiety, depression. And then in very serious cases, you might want to refer a child for psychological treatment, where they say psychotherapists and they go for sessions and all that. And the last thing that I'm going to mention is drugs. More in it's just it's in very few situations that we tend to use drugs to treat mental illness in children, because majority of the issues that predispose children to mental illness is actually psychological and social, like Dr. Ayotunde mentioned earlier. And once these issues are sorted, once a lot of these issues are actually resolved or treated or managed, or there's some intervention, the child tends to do a bit better. We tend to reserve drugs for really serious situations. So we can sometimes prescribe medication for attention hyperactivity deficit disorder, ADHD. In a few cases, we could prescribe antidepressants. We call them happy pills for children who are seriously, especially teenagers, who are seriously depressed. Maybe they are depressed to the point that they've become suicidal and it's very difficult to manage. So those are the few situations where we actually reserve drugs for children. Just to conclude that the mental health of parenting and mental health is as important as parenting and physical health, because I think a lot of the times people tend to overlook, they tend to shy away, they're not really sure because, for several reasons, the stigma, is mental illness really real? It is real. It's as real as, if somebody had a physical cause, they would go to the hospital and they would get treatment. Mental illness is just as real as if, imagine having a cut on your mind. You can't touch the mind, but it's as serious as something like that. Thank you very much for listening, and I'll be happy to take your questions now.
Thank you very, very much, Dr. Adeniji. That has been a great session. I wouldn't want to say it has been exhaustive, but it has been very close to exhaustive. I know there are a few things you cannot touch, but you really touched on so much that would be good for us to just unpack a little bit more. You've mentioned about from infancy, mother's mental health. Is it true that if a mother is depressed when she's pregnant, her child can develop mental health issues further down the line? That's one question from me. More are coming. Yeah. Okay. Right. So I'll say something briefly about maternal mental health. So there's several things that can happen. So there's something called maternal blues. Maternal blues is like the first few hours to the first couple of days, like 2-3 days after somebody has put to bed. Some women will say they notice that they're just they're crying. They feel very, they feel like they don't want to really see anyone. And it's not uncommon. Usually this will pass. But when that kind of state of mind now persists into weeks,
at least a week to many more weeks, and then the woman she isn't eating, she isn't breastfeeding her baby, she's not taking care of her personal hygiene, in those kind of very serious situations, then we, after an assessment, we might say the person has what we call postnatal depression. In some another form of another serious mental illness that I'll touch on it, though you didn't ask, it's called postnatal psychosis, what Yorubas will call abisinwi. I'm sorry for the people that are not Yoruba here, but our mommies and our daddies would have heard of abisinwi, where a woman, shortly after she's giving birth, she might begin to behave oddly. She might start to say she's hearing voices of people that aren't there, or seeing images of people that aren't there, or she might start to see maybe people are trying to kill her, or it might come across as a very strange and very odd present. In very serious situations, I mean, the child has to be taken away from the mother. Even for postnatal depression, the child might have to be taken away from the mother because the mother is really, really mentally unwell. And the first few weeks of life of a child, usually, what has been shown is a critical period of development, because the child, we want the child to bond as much as, God has designed the brain in such a way that the bonding, there's a bonding that you want to happen between the child and mom. So if the mom is ill during that period, it actually could affect the bonding, and this inadvertently could affect, I'm not saying it's every child who has that problem that will eventually have a mental illness, but there has been research that has shown that children of mothers who either had an existing mental illness or who developed a mental illness shortly after pregnancy, there is a slight risk later in life of actually developing a mental illness, just slight risk. So there is actually been research that has shown that it doesn't mean every child or every mother, it's just a slight risk. There's just that risk that exists. I don't know if that answers your question.
It does answer the question. Thank you. There's another thing, it's a story about bedwetting, because you touched on it briefly. And it's a child I had an encounter with, and it was a very worried grandmother. And she was saying the child does not usually bedwet. She doesn't know what's wrong. And on probing further, I was able to realize that the mother had problems with the law. And there was this talk about the mother going to prison for something new she had done. And it was after that, gauging by the timeline, that the child started bedwetting. And she now began, when we talked about it, she now began to say things like the child, when he comes home, he always asks that, has his mother called? And then he asks his grandmother that, is she going to go to prison? He asks her that question almost every day. And it was about that time that these circumstances changed. And it's just that overlap between mental health causing physical health, and it could happen vice versa. But what do you say about that?
Yes. And I just want to ask a question. How old is this child?
About 7 or 8.
Yeah. So this child was it somebody who was previously dry, as in he'd been going to the toilet? Not the bedwetting was just something that was new, right?
Yes, that was a new thing. Yes.
Hello?
Symptom. It was a new symptom. Yeah.
Right. So I would say, just from the information you give me, that it's most likely that that child was experiencing, that's a way of showing serious emotional distress. That child possibly needs some support, some counseling, because that was the only way he could respond to the fact that his mother was going to be put away in prison. See what I mean? So yes. So it might not be necessarily, he's an 8-year-old child. It might not necessarily be withdrawn. That child, if you probe further, that child might be depressed, might be just distressed that his mother would not be around for a considerable period of time. So yeah, I suspect there's a strong connection between what was going on in his social situation and why he was bedwetting.
Yeah, yeah. The other thing I'd like you to talk about briefly is separation anxiety, night terrors, and autism. Just touch briefly on them, please.
Okay. So, so with autism,
I'm putting you on the hot seat. Sorry.
So autism. that was okay. So autism is so I want to try. I don't want to use too much medical lingo. I want to make this. I want to describe it in such a way that people will be able to appreciate. So, by the age of 2, 3, you would expect that a child is able to express themselves in certain ways. So autism essentially is a disorder that affects children. Usually, you will start to see this from children under the ages of 3. So what's the aspects of their mental health that it affects is they have problems communicating. They also have problems with social interaction. And then the third thing is their approach to their environments or their approach to situations. Others is restricted. So I would give examples under those 3 different scenarios. So usually you would start to see autism in a child under the ages of, so you under the ages of 3, a child under the age of 3. So I won't expect that you will start to diagnose a child autism in somebody 20 years old for the first time. It's quite unlikely because the person would have had issues, in the past. So when I talk about social interactions, what could happen in that situation is the person could tend to want to keep to themselves. They don't reciprocate emotion. They don't reciprocate affection. So somebody shows them. I'll take for instance, a child comes down, a mom comes or a dad comes down and say, "Oh, hi," wants to hug them. A child would typically want to stretch out back their hands and want to hug their mom and dad, but they wouldn't respond to affection. They wouldn't respond to. They tend to want to be by themselves. They don't tend to interact with other people. So that's one aspect. Then there are children who are autistic who they have sometimes some of them don't talk at all. Some have very restricted speech, and it goes on like that for years. As in, they grow like that into adulthood. So their communication is restricted. They're not expressing themselves as how you would expect for their age. And then the third thing is their method of their play. So you could find them wanting to, maybe they are playing with a train or whatever. They like their items or their play or their environment to be in a certain way, and they don't want any disruption. They want it set. They have kind of like a restricted way of approaching this different situation. If someone comes and disrupts it, they will throw a tantrum. So essentially, other people might term them as odd because they will be in a social situation and they would say, someone is talking to them and they are quiet. The other person might perceive it as being rude, but the person is really just is actually autistic. That's the simplest way I can put it. There's something called autistic spectrum disorder. So what they later found is that it's like a spectrum. So on one extreme is what I just described. People who are not speaking to anyone, they have issues with socializing. And then the other extreme is where it's not as serious, where it's a bit milder, where there are people who are, they manage to talk, but they might have difficulties with interacting with others, So there's something called autistic spectrum disorder. That's the simplest way I can put it. I don't know if that makes sense.
Yes, you have. It's just that I know that there's an overlap because many times they have anxiety problems. Many times it's not in isolation. And especially because some people are not very familiar with it. Sometimes they don't realize what's going on, and they usually need to have medication because they kind of have a mental illness overlapping. So that was why I brought it up, actually, because of its relation to mental.
Sometimes it's very possible. Yeah, it's very possible. You talked about separation anxiety.
And what can be done about it in a child?
You talked about separation anxiety.
Yes.
Okay. So with separation anxiety, really, so in the first few years of life, there's an attachment that a child would typically have with a mom. So when it then becomes difficult, at a certain stage, children tend to, they start to, have their own friends. They want to go to school. They're not as clingy towards mommy and daddy as much, they're happy to go and visit a friend or go and play with their friend. But children who suffer from separation anxiety, they find that phase quite difficult to navigate. So they might not want to leave the house, for instance. They might not want to leave, they're in a social situation. Maybe other children are gathered playing. They'll just sit on their mom's lap and they don't want to leave their mom, and that becomes quite difficult. I think in that kind of situation, is to approach you could get support. Maybe you see like a child, there are psychologists and there are counselors, that they would give the parents information on how to help that child navigate the abilities to be able to give them that sense that if you are away from mom doesn't mean that you are unsafe, because that's the feeling that the children have, that if my mom is not here, because the mom represents for them an object of safety, an object of stability, someone they are familiar with. So if they're not with their mom, they become anxious and they don't want to be in a situation where they're away from kind of like that stable figure. So I think with the parent and the child, working with counselors and psychologists can actually help the child to navigate that phase very easily, and then the child can start to play with their peers, be away from their mom, and they don't find it upsetting.
Okay, thank you.
Yeah,
I think there's one more. Yes.
Yeah.
Yeah, thank you.
Okay.
Night terrors.
Yeah, somebody said Asperger's. Okay. So night terrors is a sleeping disorder. Actually, it's actually a sleeping disorder seen in children. And what happens is, I think the night terrors it happens. The person would have fallen asleep, then wakes up in the middle of the night, and they've had a nightmare, and usually they can't remember. The children can't recall. They can't recall what the dream was about, the contents of the dream. And usually, if a child is having night terrors, they would begin to have difficulties with, they don't want to sleep, or they don't want to sleep in their bed, and they're afraid and all that. So, and it can actually be a pointer to something deeper. So I think a child who is having issues with night terrors will need to see a psychologist. It might be a pointer to something else, psychologist, and explore around that and help the child. Yeah.
Thank you.
If I answered that question too.
Yes. I'm bringing some of these things up because many times we have a one-track mind of dealing with a particular issue. Of course, many times the default mode is to pray or to carry the child to church and say what has happened to this child. But it's important to also ask questions and explore a bit more around what's happening to the child. So thank you very much. I think you've spoken so much about the topic. It's been really, really insightful. Thank you so much. I don't know whether anybody has a question. Yes, so I think mental health is part of health. It should not be stigmatized. I think it is really, really common. I've had my issues with both physical and mental health. So I'm very, very passionate about staying in health and what a gift it is to be in a state of health. And it's very important that we try our best to help ourselves as well as parents and our children to stay in that state of health. And many times parents have to sacrifice a lot and be vigilant, everlasting vigilance, as Moji has been saying throughout her session regarding our children. But of course, taking care of yourself is helpful to the mental health of your child. So do not neglect your mental health. Do not neglect your child's mental health. Both are very, very, very important. I don't know whether anybody has any other question for us. If they don't, some final words from, I think one of my friends, Theo, is talking about himself, diagnosing himself there. By the way, people that are autistic, some of them, most of them also happen to be very, very intellectual and very, very intelligent people. So it's not all a downside. And because they are like that, they've found ways to cope with their situations and with life in general. So it's not, it just needs to be managed. And many of them, once they come to an understanding of who they are, they manage things quite well. So final words from Dr. Adeniji before we go. Thank you very much for gracing this session.
Yes, I want to thank everyone for listening. Oh, am I? Can you hear me?
Yes, I can hear you. Someone is saying what can be done in a situation where a 1-year-old is not crawling and is not responding to anything. Is a question. Just before you give your final words, you have one more question.
Okay. So a 1-year-old child who is not crawling and who is not responding, and there are a couple of questions coming to my mind. What was the circumstance surrounding the birth of that child? A lot of the times, a child who's, there are many reasons, there are many things that could affect the development of, a child's ability to be able to walk. Were there issues while the mother of that child was pregnant? Did she have any physical illnesses? Were there complications during that pregnancy? Those are some of the questions that would arise. And then when, in the process of giving birth to that child, where did she have, because I know in Nigeria, there are lots of people who, they don't give birth in hospitals, might go to a birth attendant to have their child. A delivery that is not properly supervised could end up with complications. So was the labor prolonged? What sort of issues around the delivery? So were there issues during the pregnancy? Were there issues during the delivery period? Were there issues just shortly after delivery, maybe the first 28 days after delivery? Did the child have suffer from an infection, have jaundice, those sorts of things? Those are the questions that's arising in my mind, that could be one of the possible causes why this child at this age is not crawling and is not able to respond to anyone. If the child is not responding to anyone, that child it's possible that child may, it's just from the information you've given me, was that child born with a hearing problem, an inborn, hearing problem? Was the child born deaf? So that child might need to see, I would advise the child needs to see a doctor and, have their ears checked out, because, what that child might need might just be a hearing aid, So there are many reasons why a child is not able to respond. They're not possibly not responding because they can't hear, and that's why they're not responding. And they cannot crawl because there was possibly an injury to the part of the brain that helps a person, that would enable a child to walk. So those are the things coming up in my mind, but I don't have all the information. But I would advise that that child sees a doctor, a pediatrician, as soon as possible and get a proper checkup.
Thank you. Thank you very much for that comment. I just remembered an interesting story of someone I met, a very charming gentleman who happens to be a interventional cardiologist. And one of the days when he was talking to us, he's quite a talker as well. He said he did not speak till he was about 4 years old, that his parents thought he was autistic. And he's like, almost could call him a talkative. So just an example to let you know that some children might be a bit slower than others. And sometimes it runs in families. So maybe the father was like that or the mother was like that. And children can be different. So in the absence of it ran in the family and it's obviously strange, it's very, very good to get checked out and not sit on it. Or if you notice anything worsening, it's very important to get checked out early, because there's specific milestones that children should have in childhood and as they are growing. Final words, Dr. Adeniji. Thank you.
Thank you very much for this opportunity, Praising Child. Thank you everyone for listening, for waiting to the end. Just want to encourage every one of us that mental health is important. It's important to take care of your own mental health as a parent, because when you have optimal mental health, you're in the best position to take care of your own child's mental health. Thank you.
Thank you very much. Those are famous last words. God bless you. Thank you for honoring us in this session. Thank you, everybody. You've been an amazing audience. Thank you for engaging with us. And on that note, we'll be wrapping up today's session, session 8. Next week is going to be exciting. We have about 3 or 4 speakers. They're going to be talking about parenting and special children. It's going to be exciting, and that would include talented children, challenged children, difficult children. It's going to be quite interesting and insightful. Some of the people talking are going to be the children who grew up a bit challenged and how they overcame those hurdles. It's going to be great to be here. Please invite everyone you can find. So with that, we'll just end with our last words. Well, not our last words, but our motto for this session on Find the Link Parenting, which is, I and the children God has given me, we are for signs.
God has given me, we have for signs and wonders.
Awesome, awesome. Thank you, everybody. God bless you.